Hi, I'm Nurse Barb Dean, a practicing women's health nurse practitioner, and I've been caring for women for over 30 years. And I've also experienced a lot of what you might be going through, from irregular periods and infertility to pregnancy, breastfeeding, and even menopause. Today we're going to bust some myths about polycystic ovarian syndrome, or PCOS. First of all, what is it? Well, PCOS, poly means many. Cysts in the ovaries. And cysts are like little water balloons that are inside the ovary. Now, every month you make a cyst when you ovulate, but polycystic ovarian syndrome means there's so many that none of them ovulate, and this leads to an irregularity in our hormonal levels, especially increased levels of the male type or androgenic hormones known as DHEA, DHEAS, and testosterone. And those lead to a lot of acne, hair growth, more oily skin. The first myth that comes up all the time with PCOS is that all women with PCOS are fat. Well, that's not true. I have patients who are triathletes or fitness instructors who are exercising 4 to 6 hours a day. You can't find an ounce of fat on them. And that's because when they're using their muscles, they're doing weight training, all of that helps counteract the insulin resistance that's associated with PCOS. Now, insulin is that hormone your pancreas makes, and it helps glucose get into your cells. With women with PCOS, they have way too much insulin, but it doesn't work very well. We say that their cells are resistant to insulin. That means the glucose doesn't get into the cells, and what happens is that glucose gets made into fat. That's why it's harder for women who have PCOS to lose weight. And I just saw someone yesterday. We'll call her Jean, although that's not her real name. She was so frustrated because she goes out with her friends. They're eating burgers and fries. All she has is carrots and cucumbers. They lose weight and she just keeps gaining weight. That's because of the underlying insulin resistance with PCOS. The second myth is that hair's not an issue with PCOS. Well, that's wrong. Hair is a big issue with PCOS. I had another patient who came in, she was crying because she had to shave her chin every single day. She had really heavy stubble. She wanted to date, but she felt like men were judging her and thinking that she was the bearded lady. With PCOS, there's so many of those male-type androgenic hormones like DHEA and DHEAS and testosterone that we have way too much hair where we don't want it, like on our chin, our chest, but we might not have enough hair on our heads. I have patients who have to use medication to help their hair grow. Here's what I want you to know. We have treatments that help with excessive hair. One of them is the birth control pill because it helps your liver make a protein called sex hormone binding globulin. And those male hormones, they're called sex hormones. So when a woman takes the birth control pill, her body makes sex hormone binding globulin. It binds to and it holds on to those male type hormones. And after about 3 months, a woman will see a reduction in her acne and a reduction in her hair growth. So if excessive hair is your issue, think about using the birth control pill for at least 3 months, and then think about permanent hair removal. The next myth is that your periods are all that you have to worry about with PCOS. It really doesn't affect too much more. Well, this is kind of a yes and a no. Absolutely, women skip periods for 3, 6, even 9 months. I had a patient, let's call her Keiko. She hadn't had a period in over a year, and she didn't mind. She didn't really mind having it, that she skipped her periods, but she was a little bit worried about that. What we found was that she ended up having not only polycystic ovarian syndrome, but when we checked her, she also had a thyroid issue, which affects about 1 in 8 women. So if you've gone more than 3 or 6 months without a period, do talk to your healthcare provider. Another big issue that happens with the periods is that women tend to have very heavy, prolonged bleeding, and that's because they don't ovulate regularly. Now, when it comes to the biggest concerns and the biggest myths out there with PCOS, one myth is that women who have PCOS they cannot get pregnant. And I want to reassure you that myth is absolutely false. Women with PCOS can and do get pregnant. And there's two important factors there. That is, we as healthcare providers help women lose weight because as the weight comes down, those androgenic hormones also come down and women may start to ovulate naturally. But there's also new medications that can help the ovary stimulate a healthy egg for ovulation, and we have good research that shows that women with PCOS can have normal, healthy babies. So don't give up hope when it comes to thinking about pregnancy. Another myth that comes up all the time is ultrasound is the only way to diagnose PCOS. Well, we do use ultrasound to diagnose it, and what we do is we have to count the number of cysts in the ovary. And a woman with PCOS will have 12 or more of these small cysts in one or more ovary. But it's not the only way we diagnose it. We also have to look at some other lab tests to make sure that some of these symptoms that a woman has are not coming from other things like a thyroid disorder or another endocrine or glandular problem that's causing more of these hormonal issues. I hope this has helped you get the information you need about PCOS and maybe busted some myths and maybe helped reassure you. I want to tell you, if you think you have PCOS or you've just been diagnosed, it's really difficult and you may feel really overwhelmed and like you can't even take in 1/10 of the information you've been given. But this information is also on my website at nursebarb.com. Take care, be well, and get the information you need so that you can make the best choices about your health, especially if you're trying to manage PCOS.